Well, we've never seen the likes of this. I mean, it's happening in Ontario, but I think for me, the key statistic for Renfrew County is that we now have something like 600 cases open, and that's a third of the cases we've had since this started. I mean, that's incredible. And you know what? That's not even the right number because we're not, as everybody knows, we're not testing to our full capacity. So it's rampant. I mean, we're seeing the spread like never before. The real issue now is how we, and with the lockdown and all these things that are going on, delay of school openings, the real issue is how we keep essential services going. And essential services starts with the healthcare sector, the hospitals, the long-term care sector. And what's interesting here, it's not so much the beds and the facilities that we're worried about. We're actually worried about the staff to do the work because the healthcare workers, frontline staff, they're getting it in the community, they're getting it from their children, and also they're very exposed at work. We have more than 10, I think we have a dozen patients in hospital today. We've never seen the likes of that before. And we had a few deaths last week. So again, we're seeing a lot of this. So we've got to get through this. I think we know that Omicron spreads wildly. It's so infectious. It's so transmissible. What we do know is that it seems to cause less severe disease than Delta, but because of the numbers being multiplied, by 3, 4, 5-fold, or more than that, tenfold, let's say, when it comes down to who's in hospital and who needs acute care and critical care, we may actually be seeing larger numbers. So people have to really take this lockdown seriously. They have to, I think the key is limiting your exposure, keeping in tiny groups, because this is how we're going to need to preserve the workforce. And this workforce, I mean, okay, one thing for the healthcare sector, but what about the educational sector? And how quickly we get kids back in schools. And we actually may be in a situation where a grocery store has to limit, well, they're limiting capacity anyway. They're counting the numbers of people going in, but they may actually have supply and distribution problems because they may find that their staff is compromised due to the number of cases. So this is what we have to work on. And I think everyone, what we do know is from Omicron is it's going to go through quickly. I mean, hopefully by the end of the month, we're really seeing a downturn. It's really what's going to happen. Is it going to be the next 10 days? Is it going to be the next 21 days where it's still going up? So again, all hands on deck. This is a very serious situation. And in each in our own way, we have to do our best to fight this. Yes, I mean, I think we're up to 40% boosters now, if I'm not mistaken. So we've really, it seems to me we're competing with Omicron. We're sort of, our doubling time. Actually, we're not, Omicron's a little closer, it's days, but we've had a doubling time in terms of weeks. I mean, now we're really at a superb capacity. So we're able to bring people in. We had problems with the registration. Booking appointments, that was a big problem. I think people need to look closely as to, to getting an appointment, or for that matter, if we do send out over social media that there's some no-shows and there's some additional opportunities. So people for vaccination, so people need to keep their ear to the ground in terms of what opportunities arise. But I think I'm very, this was sort of, again, this was a lot of pressure on us when they announced 18 and over. We were struggling to do 60 and over or 50 and over, but we seem to have adopted well. And again, this is a testimonial to the superb work that the healthcare sector has done. It may have been posted today. Okay. One of the things that's, I'll just take this opportunity. Yep. Everyone's so fed up. So what we're seeing now is we're seeing some disrespect and some lack of courtesy and some foul language and criticism of healthcare workers. And as I said in the video, look, these issues are well beyond the control of these individuals. So, don't bite the hand that takes care of you because, in fact, given how much Omicron we're seeing, it might not be there when you really need it. So people have to, hey, 90% of the public has been so supportive and terrific since this began, maybe 95% of the public, who knows? But there's a small number of people, and what they're doing is really hurtful and really disrespectful. And I'm just calling on everyone to recognize how important it is to treat these frontline people with respect and with courtesy, because they're burning out. We're losing people. People are leaving healthcare. They've had enough.